Opioid addiction. Have you been watching the news over the past couple of years? It is an epidemic. Opioids, very, very dangerous. This kind of, to me, surprising thing. A lot of these opioids are actually coming from doctors' offices.
Well, you know, some people say some doctors are overprescribing them. People are becoming very addicted after they have some kind of surgery. And kids, they're abusing them because they're in their parents' cabinets, and they're easily accessible.
There is a movement afoot to provide replacements, I think, non-addictive replacements to opioids. Let's bring in some experts. First, we have Gabby Reece, championship volleyball player and broadcast personality. Welcome to Good Day New York.
Thank you.
Dr. Scott Sigmund, noted sports physician. He also treated the U.S. ski jump team. The 60 and the 90 jump?
Oh, yeah.
Those guys had a lot of injuries.
Crazy.
That's amazing. Also, Dr. Devi Nampiaparampil.
You got it.
Nice. Physician noted to all of our Good Day New York viewers. You see her live on the nighttime news. Welcome to you all.
And she deals with pain management. So, Gabby, let's start with you.
Why am I here?
Why are you Why are you here?
Well, I fortunately and unfortunately just had my knee fully replaced 3 months ago. I tried to avoid surgery for about 14 or 15 years through taking care of my diet and movement and physical therapy, but it basically became non-functional. I wore it out. I joke that I did my years of jumping in a shorter period of time, and so this is a topic close to my heart because I wanted to avoid taking opiates. And in the hospital, I did take a strong anti-inflammatory with a painkiller, but after that, nothing.
Gabby, you've been referring to your knee a couple of times here.
Yes.
You have a massive scar on your knee.
What do you mean? Didn't they say scars are sexy?
Yeah.
This is obviously very serious,
Yes.
serious surgery. I'm sorry.
Yes.
Did they prescribe to you opioids?
I had the option, and I once I was out of the hospital, I chose not to, and that's
so why did you choose not to? Are you afraid of the addictive
Well,
quality?
I've read, I have tons of friends, and the doc can tell you about this, who, 10% of people will get addicted after 70 million surgeries for either soft tissue or orthopedics. So I'm very interested in long-term health, and we all know the side effects, or I had friends who would get addicted. So I just thought in the long run, even though it's a grind, it was better to do it. But I didn't know, that's why I'm part of Choices Matter, where you have...
You're a paid spokesperson, right?
I am, and the whole idea is equipping people. My thing is you always should be your best advocate for yourself about your health and your own pain and things like that.
So if you do this alternative, Scott, are you in pain? Like, how does that work?
Yeah, first of all, I think Gabby's story is really remarkable. I've been doing this for 20 years, and I've never had a patient come in and tell me, I want to do my knee replacement, but I don't want you to give me any opioid pain medication. She's a professional athlete, true grit, she toughed it out, but there's really good news. Literally this morning, patients are undergoing major elective surgery here in New York City, across the country, with opioid alternatives, where basically we can use other medications. They're having successful surgery with great outcomes. So, for example, I do total knee replacements. We're using new oral anti-inflammatories and medications through the IV.
Do they kill the pain?
They do, and we actually can inject this new medication directly into the surgical site. Like if you go to the dentist, for example, so you get numbed up, but this numbing medicine lasts for 24 to 72 hours. My patients are undergoing a knee replacement at 7:30, walking in the hall at 1 o'clock, telling me that they're having zero pain. And it works.
And this stuff is not addictive.
It is not addictive. There's zero addictive potential.
So why aren't doctors prescribing it?
It's a new movement, and a lot of times they're afraid to try something new, and they're busy. So that's why we're encouraging the patients to go to planforpain.com so they understand what the options and go and equipped to ask the questions.
Dr. Devi, you prescribe opioids as part of a pain management program, right?
Well, I differentiate usually surgical pain from more chronic pain. So if someone's having pain from surgery, a total knee replacement, for example, opioid medications are usually a standard option, at least for maybe a week or two. After that, you start to wonder about other causes of pain. I agree with Scott and Gabby that if it's possible to use other things in addition sometimes. If some people can do it as an alternative, that's fine. But whatever we can do to improve the pain control and minimize the side effects.
In addition, though, you're still thinking that opioids should be prescribed?
I think they should be prescribed for the average patient. For most patients who come in.
We're trying to minimize opioid exposure to our patients. Surgery has become an inadvertent gateway right now for the substance abuse crisis we're seeing across our country. Our message here today is loud and clear. We want to empower our patients. You have a choice. You can go to the doctor and request alternative methods. If you're not sure what to ask, Plan Against Pain is a wonderful new website. Get on there. You can print out the questions, bring them directly to your doctor, and encourage that doctor to have a conversation.
I have to tell you, my son's girlfriend recently had knee surgery like you did. She came home, she was staying with us. I can't tell you how many different opioids they gave. I was shocked. I became the nurse because I was concerned having so many different painkillers in my house.
Well, and that's it too, is if they don't get used and then they're sitting in the house, that's
And I mean, like 30 and 60 of various different opioids.
We need more monitoring. I agree with you. I think there is a huge problem with overprescribing of these opioids, and I think it's also the fact that a lot of people don't have training in pain management. I mean, in my field, we have a lot of experience in it, right? But otherwise, people don't always look at not just pain control, but how is this person functioning? What are the side effects? What are the other risk factors that are there in the household as well, and in their job and at home?
Gabby, one more time on that knee.
Can I say one last thing?
Okay.
If you're going to have a major surgery too, I would just like to remind people that you might have a little bit of discomfort, and that's okay too.
Yeah,
and
but you don't want to be in major pain.
Listen, I've just gone through it myself. I know. I've done weeping in the closet. I'm saying, but just to manage, be calibrating both.
I don't think you can see the scar from that angle. It's pretty substantial.
He's going to have nightmares about my scar tonight. See him? Look at him.
Well,
she wears it proudly.
I did it so you could see, though.
Yeah, you want to highlight it.
Well, I want to say that I understand, but planagainstpain.com at least gives them an opportunity to navigate it.
I mean, Dr. Devi, with this movement and everything, are you concerned that people who are chronically in pain will not be able to get the kind of medication that they need?
Well, I think if they see certain doctors who specialize more in chronic pain, they may still have that chance of getting what they need, whether it's pain medication or other things, of course. But my concern is before this opioid crisis started, we had a real problem in society with undertreatment of pain, especially for cancer-related pain and surgical pain, and that was doctors disproportionately prescribe pain medication or undertreated pain in blacks, Hispanics, Asians, and children. So the people who are more vulnerable in society tend to be the ones that have a harder time with pain control.
You know who's vulnerable to pain? Ski jumpers. Take a look at this. Scott Sigmund.
He's fascinated with the ski jump.
Treats ski jumpers. Look at these guys. First of all, I think they need to be treated mentally and physically.
That's a different medicine.
The most extraordinary sport. I always enjoy it. I mean, how do you do that for the first time?
You start on a very small hill.
You just build up?
And then they work their way up all the way up. Everybody's just saw the recent movie. It was kind of funny. But Eddie the Eagle for sure.
I didn't see it.
Oh, it's all
Eddie
about
the Eagle?
Love ski jumping. It's all about it. It's fantastic. Yeah.
So, Gabby, are you doing any sports these days, or?
I'm still physically doing rehab, but I'm very mobile, and you're mobile very quick. I mean, really quickly. You just have to grind through it. And right now, I'm still going through my PT, going for extension and greater range of motion.
All right, Gabby Reece, keep it up.
Thank you.
Scott, best of luck to all your team members.
Yes,
may they always land safely.
Dr.
Yikes.
Scott Sigmund, appreciate it. Where's your office, by the way?
Lowell, Massachusetts, North Chelmsford, about 20 miles north of Boston.
And Dr. Devi, where can people find you?
Oh, in the financial district, so it's called Metropolis Pain Medicine.
Very nice.
Thank you.
All right, did you learn something?
Pretty much. If I get surgery, I'll call you back.
Perfect.
Beyond that.
You won't need it. You won't need it.
Can we see those ski jumpers one more time? I mean, this is the most radical sport I've ever seen in my life. I think they should get a gold medal just for showing up. I mean, and then they warm up. You ever see that to get the more velocity?
Yeah, right. They want to go faster.
I remember the Placid Olympic Games and 60, and then there's 90, 90-meter jump.
Hey, Gabby, I'm just curious while we have you here. Would you have gone to Brazil with all the Zika talk going on right now?
You know, for me, I don't know that I think I might have avoided Brazil a little bit, but listen, if you're an Olympic athlete, you're going, you're not thinking about that, you're thinking about your training and you're thinking about your goal, and they're not worried about that other stuff.
Gabby, one more time, you've got abs of titanium.
Well, I'm offsetting my you know, the scar that's freaking you out, you see?
No, it's
You're still in great shape. I mean,
listen,
how do you do
there's no reason. I'm committed to this lifestyle, and this is what I tell people. It's like priming the pump. You don't have to do hours and every day, and consistently eating well and moving just a little bit. You can stay there.
Fantastic. Thank you very much, all. Let's take a quick peek outside if we can. What's happening out there? Rosanna, would you ever do that for a Good Day New York adventure, a ski jump?
Are you out of your mind?
Okay, what about sleigh riding? Maybe this winter.
Sleigh riding, yes, totally.